There's a tremendous amount of pressure to get a vaccine out. In fact, normally the evaluation of a candidate vaccine would take anything from 5 to 10 or even more years. And that's what's happened with other vaccines. But there's now been so much pressure because this is a unique event where this outbreak has caused a tremendous amount of economic loss, human loss, and impinging on other healthcare problems as well. So there's been this tremendous pressure to get a vaccine out as soon as possible. So many of the stages have been compressed, and also the manufacturing, because remember, the one thing is to evaluate the vaccine, get a vaccine which does work and is safe. The next stage is to kind of scale up manufacturing, because now we're talking about billions of doses to immunize the world, as it were. Many of the manufacturers are manufacturing at risk. They're manufacturing candidate vaccines, although they still haven't completed their trials, their safety and efficacy trials. So that's also compressed the trial. So there has been criticism because we're rushing it at such a tremendous space, trying to get a vaccine out within a year or just over a year, as against 5 or 10 years. But on the other hand, I think that the controls are still there. I think we can reassure the public that the vaccines are undergoing critical evaluation in the trials now. But that's not the end of the story, that's just the beginning of the story. There still has to do validations. There are regulatory authorities which are totally independent of the trials, totally independent of the manufacturers, to assure the public that vaccines are safe. I think everyone is cognizant of the fact that vaccines, as different to drugs, as different to medicines, vaccines are going, in the vast majority of cases, into healthy people. So you're giving somebody, a healthy individual, something which is foreign, and you have to have a very, very, very high standards. It's not only the efficacy of the vaccine and the safety of the vaccine itself. The regulatory authorities also assess the stabilizers, the chemicals, the diluents, all that gets assessed. In fact, the regulatory authorities, those protocols come in a truckload for them to kind of go through all these protocols. So there is a tremendous amount of oversight into vaccines.